Hello, hi. My name is Dr. Karen Perez, and in this recording lecture, I'll be discussing nursing self-care, nurturing the caregiver to care better. So the objectives for this lecture is that we're going to be able to define the concept of self-care and explain its importance to nurses. We'll also be able to identify common causes, signs, and consequences of stress, burnout, and compassion fatigue among nurses. We're also going to discuss the impact of consistent self-care and patient safety. We're also going to discuss and describe evidence-based self-care strategies that address physical, emotional, mental, and spiritual and social dimension of well-being. And we're going to also talk about and apply some practical self-care techniques that can be integrated into the daily nursing routine in the clinical setting. And last but not least, we're going to develop a personalized self-care plan designed to enhance resilience, work-life balance, and long-term career satisfaction. So let's look at the vital importance of self-care. So why is self-care, or why does self-care matter for nurses? Nurses face a unique constellation of stressors daily. The demand of patient care, the emotional labor of supporting individuals who are suffering, spiritual challenges of witnessing life transitions, mental strain when it comes on to complex decision making for your patients. So just keep in mind that self-care isn't selfish. It's actually the foundation that sustained your ability to provide a holistic care to others. So without adequate self-care, these stressors compound and they can lead to a lot of things like diminished resilience, compassion fatigue, reduced quality of care, and even a shorter professional longevity. Now, the caregiver paradox, you cannot pour from an empty cup. So those who excel at caring for others, one of the things that we notice that is that they often neglect to care for their own self. So in nursing, we are attending to the physical and the emotional and spiritual environment needs of our patient, but we must recognize that self-care is not an option. It is actually essential to our practice. So in this section, we're going to explore why self-care is not just beneficial, but is essential for holistic nursing practice. We're also going to examine the science behind caregiver stress and introduce fundamental concepts that will guide our journey towards better self-care. So the cost of neglecting self-care. Emotional and mental cost. We have moral distress, decision fatigue, reduced empathy. And we know the role that empathy plays when we're taking care of our patients. But when we neglect ourselves, all of this is impacted. As it relates to the physical consequences, there are chronic fatigue, hypertension, heart disease, compromised immunity, because when we're stressed and fatigued, our cortisol level goes up, then it affects the inflammatory process, and the inflammatory process in our body then can cause a lot of other diseases. When a nurse is burned out, is fatigued, has reduced empathy, heart disease, hypertension, chronic fatigue, it impacts not only the nurse, him or herself, but it also impacts the nurse's professional life. Then they'll start making errors. You'll notice an increase in errors, decreased patient satisfaction. When they're now giving their feedback, then the hospitals start getting a low score on their patient satisfaction. Then a higher turnover, career dissatisfaction. There are a lot of nurses who are leaving the profession of nursing. Early retirement may result. So when a nurse neglect him or herself, it affects It's a multi-dimensional effect, not only on the nurses, emotional and mental, but also physical and also professional. So research shows that neglected self-care creates a cascade of negative outcome that affects not only the nurse, but also the patients, their colleague, and the healthcare organizations itself. When the caregiver needs care. So this moment of depletion is all too common to a lot of nurses. Recognize the signs early is one of the first steps towards healing. So let's look at defining self-care nursing. So self-care in nursing is a multidimensional practice that encompasses physical. So we're talking about nutrition, the food that we're taking, movement and rest. And I have to say, I feel somewhat guilty talking about this section because when we talk about nutrition, we know that we should include more fruits and vegetables in our diet. And if we're trying to build muscle, then we're talking about increasing the amount of protein that we're taking, and then also including exercise in our daily activities, and then resting, going to bed early. And for me, for one, I love to work late. I love to work like, 11, 12 o'clock at night when everything is quiet, no email coming in, no phone is ringing. So I'm up late most of the time. And as it relates to nutrition, I'm used to a lot of starch. So I'm from Jamaica, for those of you who don't know. So dumplings and rice is a main source in Jamaican diet. So now transitioning to incorporating a lot more fruits and vegetables is challenging for me, and it can be challenging. But the information that I gained from the expert who says, and Dr. Maud is noted in this picture here, and she was at one of our conference, start low, go slow. So I don't have to transition and change my diet drastically, but take my time to incorporate these things over time till it becomes the norm. Emotional, processing feelings and emotional regulations. In our conference that we had the other day, Caitlin, one of our speakers, talked about the blowfish and how we can regulate our feelings instead of responding immediately. Take time to think about what the issue is. So if someone is upset, then you don't want to get upset because that person is upset. All right. So take a moment or time to process what you're feeling and to regulate your emotions. And trust me, I've come a far way with in terms of regulating my emotions, and it's not something that is done easily, something that comes over time and with practice. Mental, and we're talking about cognitive well-being and continuous learning. So by listening to this recorded lesson, you are meeting the needs of continuous learning. You're learning about self-care, but there's so many other things that you could learn about. But in this lesson, we're talking about self-care, and this is part of the mental part of taking care of yourself. Cognitive well-being, make sure that cognitively you're doing well. Spiritual and spirituality, keep in mind that spirituality is different from religion. Spirituality doesn't mean Christianity or Judaism or any other religion. It's actually, spirituality is, what is the meaning of life to you? What is the purpose? And what it is that you're connected to. And some people are connected to a higher being. All right. So spirituality is searching for that meaning, searching the purpose of life. And social, form a community, right? It could be a nursing community, it could be a church community. Get a support group. But while you have that support group, remember to have boundaries. Okay. So as Dorothy Oram says, that this approach is rooted in her theory big time. And this positions self-care as both the nursing responsibility and a personal practice essential for optimal function. And to take care of yourself, you are actually taking care of your patient indirectly. Because if you are not well, the care that you're delivering will not be on par to get a good patient outcome, and can even affect the type of care that you deliver. All right. All right. So let's look at the 7 components of self-care. Health promotion. So proactive practice that maintain and enhance well-being, like exercising, doing yoga, meditation, take different classes. And this is before you want to try prevent the issue before it occur if you can. So when we talk about health promotion, you wanted to take a proactive step. Educate yourself, continuous learning about health and well-being. System navigation, effectively utilizing the available health resources. So a lot of hospitals and healthcare organizations, they do have a gym. So if you're working with an organization that have a gym, go ahead and sign up. You can go to the gym before you go to work, so you reach work a little bit earlier, or you can go to the gym after work. And I've heard of nurses going during your lunchtime. And you may be saying, lunchtime, is that possible? Not taking lunch is actually not taking care of yourself. Illness prevention, strategies that minimize disease risk and manage symptoms. So including eating well, exercising, getting your regular checkup, monitor yourself, regularly assess your personal health indicator, pay attention to your own personal self. And this part I have to put in a personal story. So I was diagnosed with thyroid cancer in 2015. And my sister is the one who pointed out that my neck was swollen. And the funny thing about it, we were at church when she said, "Your neck is swollen. Is it okay?" I'm in front of the mirror every day to get ready for work, brushing my teeth, washing my face, taking a bath, and I did not notice that my neck was swollen. So what I'm saying to you is to make sure that you monitor yourself. So if any changes come about, you're able to identify, you're able to see, okay, this is different because this wasn't there last week. All right, so that's very important. Self-management. Take responsibility for health behaviors and choices, which I know sometimes can be very difficult for a lot of us to do. Collaboration, working with healthcare professionals as needed to take care of your own well-being. So we're going to look at the science behind self-care practices. And you also the word holistic. Holistic is taking care of yourself as a whole, not only your physical, but your mental, your emotional, and your spiritual well-being. So understanding the physiological mechanism that makes self-care effective can help you and I implement some of these practices with confidence and also commitment. So this chapter explores evidence-based research supporting various self-care modalities. So let's jump into it. So stress physiology and nurse's body. So stress trigger. You may have patients that are challenging, or their case, I should say, patient cases that are challenging. You may have staffing issue, maybe not enough staff to cover, or maybe a conflict with something with another staff, moral distress in terms of the decision that need to be made. The patient may need one thing and you may be seeing another thing. So all of that can trigger kind of stress, or could be a traumatic event that activates your stress response. SNS activation, which is a sympathetic nervous system, triggers a fight or flight response. With that, you have cortisol increasing and adrenaline releasing. So what this causes is a system-wide effect. With cortisol and adrenaline releasing, you have a elevated heart rate, blood pressure. It affects the respiration. It suppresses the immune system. And with this immune system suppressed, then you are at risk for having infection. It affects the digestion and also affect your sleep pattern. So a chronic activation, when you have a sustained stress response, it leads to what we call a allostatic load, and it increased diseases vulnerability. Just as I said, with the immune system being low, then you are at risk for, so many of the disease process. So let's jump into some of these evidence-based strategies that can be used. Progressive muscle relaxation. So the science behind that this is a systematically tensing and releasing muscle group. The research showed that it reduced cortisol and adrenaline level by 27% in studies. It also increases the alpha brainwave, and this promote relaxation. It also reduces endogenous opioid it's like a natural pain reliever. So for the clinical benefit, it decreases migraines and tension headache by 67%. It reduces neck, back pain, common in nursing, and it also improves the immune function marker and enhance sleeping quality and also the duration of the sleep. So how do you perform this PMR, which stands for progressive muscle relaxation? So first, you're going to prepare and find a quiet space. You're going to be sitting or laying down, preferably in a relaxed position. If the clothes is tight and you want to loosen any tight clothing, take a few slow, deep breaths. Inhale through your nose and exhale slowly through your mouth to begin calming down, your body. Close your eyes if you're comfortable. What happened is that this enhanced focus and awareness and kind of block out any kind of distraction. So you're going to tense each muscle for about 5 to 7 seconds and then release for 20 to 30 seconds. You will work through, major muscle group one at a time. So you will start from your toes, tensing your toes for about 5 to 7 seconds and releasing it for about 20 to 30 seconds. You should notice the relaxation, the difference between the tension and the relaxation. For example, let's talk about the hands and the arms. And the rule of thumb is that you start from the bottom up. So you do your toes, you do your calves, you do your thighs, and you work it up. When you reach your hands, what you can do, you can clench your fist tightly. You're going to feel the tension in your hands and your arms, and then you're going to slowly release them. All right? And you do this for your upper arm, your shoulders, your neck, your jaw, your face, your chest, your back, your abdomen, your thighs, and your calves, as mentioned before. And you do that until all is done. And once all the muscle groups are relaxed, take a few minutes, slowly deep breathe. All right. And then focus on the sensation of a calmness through your body. So when you're ready, slowly open your eyes and then return to your regular activities. And this is called the progressive muscle relaxation, or the PMR. Then we have the Jinshin Jutsu, self-help. So this is an ancient practice. They now use it in modern science. It was founded in the Japanese culture, in the acupressure technique. And this is based on energy, where the tension causes a bioenergy blockage. So self-administered finger holding, and what it does is harmonize energy flow. And you want to look, the guy that made Tesla, what's his name? Guy that made Elon Musk, that you will see when he sit down, his fingers or his hands are in a certain position. I'm going to call the short for this JSJ. So how to do this technique? You find a quiet place, sit comfortably, or you can stand if you're at work. Take a few slow, deep breaths to center yourself, and you can close your eyes if you would like. Then use your opposite hand to hold one finger at a time. So each finger is linked to a specific emotion or organ system. Hold each finger gently, not tight, for about 2 to 5 minutes or until you feel calm or light pulsing sensation. So that's the JSJ. And they said that its use, research show that it reduces anxiety scores by 52% in healthcare workers. It lower heart rates and blood pressure within minutes. It improve emotional vitality and caring efficacy, and low cost and safe, accessible intervention with no medicine. All right. Diaphragmatic breathing. So this technique is a deep belly breathing that fully engages the diaphragm rather than a shallow chest breathing. So this stimulates the vagus nerves and activate the parasympathetic system. This is the resting and digestive system. In terms of the physiological effect, it slows heart rate, it reduces blood pressure, it increases oxygen exchange, it decreases muscle tension. And the benefit, it reduces anxiety, improve focus, and create a mental clarity within about 90 seconds. So they use the 4-7-8 breathing technique. Inhale for 4, hold for 7, and exhale for 8. And this is particularly effective for quick stress relief during a nursing shift. So please go ahead and try this technique. You inhale for 4, hold it for 7, and exhale for 8. So neurological impact of mindfulness and meditation. It shrinks the fear center, which is a fear center by up to 15%. It thickens the prefrontal cortex, which deals with executive function. It enhances the insular activity that deals with empathy and compassion. It also increases the gray matter in areas related to attention. So as it relates to benefits for the nurses, 31% reduction in burnout symptoms. It improved patient-centered communication. It enhanced clinical decision-making. And the nurses have a greater resilience to workplace stressor. So let's go to the step-by-step of basic mindful meditation. So you want to find a quiet, comfortable place. You want to sit upright in a chair, on a cushion, or stand if you're on the unit. Relax your shoulders. Rest your hand gently on your lap or by your side. Close your eyes or keep them softly focused on a point on something ahead of you. All right. After doing that, you want to focus on your breathing. Breathe naturally through your nose. Notice the rhythm of your breathing, the rise and fall of your chest or belly. In some cases, if you're at home and you're laying down, you can actually put one hand on your abdomen and another one on your chest. So you can actually feel the rise and fall of your belly and chest. So if your mind starts wandering, gently bring back your attention back to your breathing each time. Try this for about 2 to 5 minutes, especially if this is new to you, and gradually extend it to 10 to 15 minutes as you get more comfortable doing so. So you want to notice or observe the sensation, the warmth, tension, contact with the chair. Then when thoughts arise in your head, and they will, like, I need to finish charting, or what's next on my list, simple notice them, without judging yourself, and then return back to your breathing. All right. You want to expand your awareness. So after a few minutes, broaden your attention to your surrounding, the sound, the smell, or the feeling of the air around you. Let yourself simply be present in the moment. And you want to end with gratitude. Take one last deep breath. Acknowledge one thing you're grateful for, your health, your skill, or your ability to care for others. Open your eyes slowly and carry that sense of calm into the rest of your day. All right, so that can be used as it relates to mindfulness and meditation, and this will definitely reduce the anxiety, reduce any form of stressors that you're having. And we know that nursing can be stressful. So just 10 minutes of daily meditation practice can actually create measurable changes in the brain structure within 8 weeks. So mindful meditation actually reshapes the brain. All right. So as I mentioned early on, that it shrinks the amygdala, which is a stress center, and this is a part of the brain that triggers the fight or flight response. So during chronic stress, like what nurse often experience, this area become very overactive and it keeps the body in a constant state of alert. So when you do the regular mindfulness meditation, you will start seeing a reduction in size of the amygdala. And this means you are responding to stressful situation more calmly, and recovery will be much more quicker. So practical self-care strategies for nurses. So moving from theory to practice, in this section, we're going to offer some concrete strategies for integrating self-care into your daily lives. We'll also explore technique across the dimension of well-being that can be adapted to your unique needs and circumstances. So physical self-care essential. Movement. You want to aim for about 150 minutes of moderate exercise weekly. Consider yoga, walking, or strength training that can be done in like short intervals. Nutrition. Focus on anti-inflammatory food that are rich in omega-3s, antioxidants, complex carbohydrates, and prepare nutritional dense meal in advance for busy shifts. Hydration. Drink at least 2 liters of water daily, or mild dehydration can impair cognitive function by at least 15% and by affecting clinical decisions that you make while you're working. Sleep. Prioritize sleep. 7 to 8 hours of quality sleep. Create a consistent bedtime ritual and optimize your sleep environment, especially if you're working, especially night shift, which as we know that nights are time to sleep. So make sure, and when we talk about creating an optimal sleeping environment, that means no cell phone, no YouTube while you're in bed, no TikTok, because just the light illumination from the screen actually can interrupt your sleep pattern, and even the television too. So physical self-care forms a foundation for all other dimensions of well-being. Even small improvement can yield a significant benefits for energy and resilience. Emotional and mental self-care. Emotional strategies, journaling. This is a process difficult for a lot of nurses because of the time that it may take. But this can help you process difficult patient interaction through reflective writing. Emotional check-ins. Schedule brief moments throughout the shift to assess your own emotional state. Expressive outlets, art, music, dancing, and other creative pursuits that helps you release emotional tensions are also beneficial. Professional support, counseling or therapy to process workplace trauma. As it relates to mental strategy, boundary setting, which is vital when it comes on to any profession, but especially with nursing, clearly limits between work and personal lives. Digital detox. I mentioned early on the other slide about putting away the phone, turning off the TV, just reducing the light illuminating in your face, which interrupt with your sleep. But sometimes the news can be so disheartening. It's, worse than some of those action movies. So if you're one that taking or consume a lot of news and social media, sometimes you need a form of digital detoxing. Take regular breaks from the news and social media as needed. Cognitive restructuring. You want to identify any kind of challenging and negative thoughts that you're having and challenge those thoughts. Because believe it or not, for some individuals, thought come up in their head, I'm not good enough. I can't do this. I am ugly. I'm not a good mom. I'm not a good daughter. So you need daily affirmation to restructure those thought process. So when those negative thoughts come in, you use the positive thoughts to challenge them. Continuous learning, professional development that brings joy and inspiration. So now we're talking about self-care. And when we talk about professional development, a lot of times we think about CEUs, things to do to get CEUs. While CEUs are great, but you can do other things that is professional development, but not necessarily geared towards clinical setting directly. Like this lecture, we're talking about self-care, we're talking about you, which you will get continuing education on, but it should be when we're talking about professional development, in addition to getting your CEUs, it must be something that is of interest to you, something that brings joy to you, or something that can inspire you. Spiritual self-care. So early on, I mentioned that keep in mind that spirituality is not necessarily religion or religious, right? It's when we talk about spirituality, we're talking about searching for the meaning and the purpose of being. So meditation practices, regular meditation, focus on breathing, loving kindness, body awareness, cultivates a kind of inner peace and perspective. Even about 5 to 10 minutes daily can significantly reduce stress. Because remember, whenever I think of stress, I'm thinking about adrenaline up, cortisol level up, inflammatory process, and then diseases follow afterwards. So spirituality and self-care, we're talking about nature connection. Spend time outdoors, whether it's in the forest, and some of you might like, okay, I don't have time to go to the forest, or you may not like the forest. It could be going to the beach, going to the pool, going to the garden. Restore that spiritual energy and provide a kind of perspective on life's challenges. I remember I went to see the sunset and the sunrise. This was on two different occasions, sunset and sunrise, and it was one of the most beautiful. I didn't know. I was in awe. Everything that I had going on, I was thinking about, went to the side, because just to see the sun go down, and the song that that came to mind is like, "Don't let the sun go down on you," and the sun was literally going down. So just take in nature itself, and it may not be gardening. You may not like gardening. It could be animals, go to the zoo. It could be the water, go by the beach or go by the pool. It could be something else, but let yourself connect with nature in this world. And trust me, I can attest to that. We are so busy running from here to there, doing this, a part of that committee, doing this work, doing that, that we forget to connect to nature. Reflective ritual. You want to create a personal ceremonies to mark transition and honor your difficult experience that you have, and also celebrate your success in nursing practice. I have to say that as nurses, we don't celebrate ourselves and we don't celebrate each other enough. And when you look at other professions, a lot of times you will see that this person win teacher of the year. And I'm not just talking within an organization, I'm talking about national, or within a county, or within a city, that they celebrate each other's. But when it comes on to nurses, we think if we talk about our accomplishment, we think that we're showing off, so we don't want to talk about it. And then not only that, others don't celebrate you when they know of your accomplishment. But if they don't, I'm telling you this, you take the time, you can look back on where you're coming from and where you are now, and you want to be able to celebrate those successes. All right. Purpose cultivation. You want to regularly reconnect with your deeper why for becoming a nurse. And I know we see holistic nurse here. Holistic nurse is a nurse that cares for the person on a whole, taking in their physiological needs, psychological needs, spiritual needs, emotional needs. All right. So you want to look back on the deeper why did I become a nurse? And you do this through journaling, discussion, and look back and to reconnect to your purpose. I remember my youngest son found one of my journal, and he told me, "Mommy, I found a journal that you started writing before I was born." I was like, "Really?" And I was wondering, what is it that I had inside there? So when I went back and I looked and I was reading it and going back to see what are some of the things that I was saying, what was my thought process, what was I grateful for, and to connect. It was a sort of striking different from where I was at that time and where am I now. So you want to cultivate, like, what was my purpose for becoming a nurse? What was my purpose for doing this? And you want to make sure that you connect that. So spiritual self-care nourishes your deeper value, and it helps maintain a perspective amidst this intense healthcare work. I mean, nursing is not for the weak. It is a lot. So this sense of nourishing your spiritual self-care creates a resilience by connecting your daily nursing tasks to a deeper meaning and a deeper purpose. All right. So when we talk about spirituality, we're not talking about Christianity, Judaism, Allah, and all the others. We're referring to the deep, and it can mean when we talk about deeper meaning and deeper purpose, those deeper meaning and those deeper purpose can connect to a super being or a higher being. But the spirituality is searching for those deeper purpose and meaning. Social self-care. So nursing can be simultaneously socially demanding and isolating. So intentionally, social self-care includes forming a relationship with your colleagues, building a supportive connection with fellow nurses who understand your experience. They can relate to what you're going through. They're nurses themselves, and I'm sure they may have some stories up for themselves to tell you. So also have non-nursing friends. Maintain this kind of relationship outside of the healthcare to provide a perspective. Family time, which is vital. Quality connection with loved ones that offer unconditional support is vital to your function and your self-care. Community involvement. You want to participate in groups or causes that bring joy and purpose to you. There's so many things, like I'm a part of a church group. I'm also part of ONS, and I'm a part of a lot of other groups. So find a community that resonates with you. For your leisure time, pick up a hobby. I picked up ballroom dancing, which I love because I've always loved Dancing with the Stars, and I watched Dancing with the Stars, and I wish I could dance like those. So I went and took ballroom class. So what is it that you wish that you could have done? When you're watching TV, do you wish you could cook or bake like this Ramsey guy? Take a cooking or baking class. Do you feel like you want to dance or act? Do you want to stand on the stage and, do spoken words or poetry? What it is that you think you want to do within your leisure time. Engage in a hobby or interest that creates a flow state and a positive emotion for you. And I'll strongly advise that. It can be nerve-wracking, especially if you have to stand in front of a crowd, but I guarantee you, when you do it, you're going to say, oh my gosh, I did it. But connect with others. Connection fuels resilience. So if you look at this photograph, this is a conference that we had between September 26th and September 27th. We had Dr. Maud came in and she was showing us to get up and move. And this conference was one of the best. So just keep in mind that connection fuels resilience. So at this conference, I was able to meet so many of the nurses, connect with so many other nurses. So keep in mind that social support among colleagues create a kind of protective buffer against workplace stressor. Nurses who report strong workplace relationship shows 41% lower burnout rate and a greater job satisfaction. 5 steps to nursing self-care. 1, assess. You want to first assess, evaluate your current self-care activity and identify neglected area using holistic tool assessment or any other nursing tool assessment. Then you're going to diagnose yourself. Identify a specific need across either physical, emotional, mental, spiritual, or social dimensions. What is it what's the problem? After you identify the problem with the nursing diagnosis and create a plan, use a SMART goal for your self-care that fits a realistic within your schedule and preference. So one of the things that is most common is like, oh my gosh, I want to exercise more. That's me too. I actually had a plan that I was going to exercise 5 days a week. It was not realistic. I would love to. 1, I need the consistency, which I'm having difficulty with. 2, I work and have a family, so it makes it difficult to go there 5 days a week. So because of that, the plan wasn't realistic based on my schedule. So set realistic goals so they're more attainable. Then implement it. Consistently practice your chosen self-care activity and start small. And then after you start small, then you start building gradually. And then you can go back and evaluate regular assessment to look at your progress and to celebrate those wins and to adjust the plan as needed. And I have to tell you, I decided that I wanted to stop eating meat. And so I started eating more fish, more plant-based food. And today, as I haven't ate meat for about 2 months. And today my son asked me to fry some chicken for him, and I did. And I actually had 2 pieces of chicken today. Now that means I falter. I didn't stick to my plan of not eating meat, right? So does that mean that tomorrow I'm going to say, oh my gosh, I done spoiled it already. I'm just going to continue eating meat. No, I'm going to get back on a horse tomorrow and start with my plant-based diet and, a little fish every now and then. All right. So there's times when you set a plan and you may say you're going to exercise on Mondays and end up not exercising Monday. That doesn't mean that you should evaluate it to see why you didn't go, but continue, readjust the plan, and then continue. All right. Integrating self-care into daily nursing practice. So finding time for oneself during a busy shift can seem impossible. But for the next upcoming slide, we're going to explore practical techniques that can be incorporated into your workday and helping you to maintain a well-being during the most challenging time of your shift. Because I'm sure if it's not a coworker, sometime it's a patient or management, that can cause you to, become that blowfish. So let's look at some techniques. 3-minute breathing space, a brief meditation that can be done between patient interaction. 1 minute, awareness of current thoughts or feelings. So you're saying, okay, what am I feeling now? I'm feeling upset. I'm feeling angry and I'm tense. 2, focus attention solely on your breathing and breathe at the abdomen. Breathe from your abdomen. So you're going to focus on your breathing. After you're aware of what the current thoughts and feeling is, start breathing. You're going to expand your awareness to your whole body before returning to work. So that's a 3-minute breathing space. Then we have the 5, 4, 3, 2, 1 sensory grounding. So when overwhelmed, you want to identify 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This will help, kind of regroup you during stressful time. Then we have the micro moments of awareness. Brief pause throughout your shift. Hand washing mindfulness. So you want to focus completely on the sensation. So it's not just washing hand out of ritual and out of based on policy and practice. When you're washing your hand, you're going to be present while washing your hand. You're going to focus on the task and then the sensation. What am I feeling? Am I scrubbing too hard? Look at your nails. Not necessarily only for the hand washing part of it, but distracting everything else and being present while washing your hand, focusing. Another brief pause throughout your shift could be a doorway transition. Pause briefly before entering a room, or charting breaks. 3 conscious breaths before you start documenting. So these techniques take seconds to minutes, but can reset your nervous system and restore focus during a very challenging shift. Okay, so go ahead and try these. Create a personal self-care toolkit. So a physical toolkit, you want to have a PMR audio guide on a smartphone. When we talk about the contracting and releasing the muscle, it will guide you through how to do the process. So you could have that on your smartphone. Aromatherapy roll on for quick stress relief. Put some lavender, have a small container of lavender in your bag or something that you can put on, smell for stress release. Healthy snack for sustained energy. Comfortable shoes with proper support. Those are some of the physical tools. For mental and emotional tools, meditation app with about 1 to 5 minutes option. Guide the GSJ sequence, save on your phone. Pocket journal for processing difficult moments. Photo of loved one or an inspiring place. If there's a photo of a place that inspires you, have that on your phone. I can tell you, with flowers, I love flowers. And whenever I whenever I have flowers, I don't buy it often and I don't get it often. But when I do buy myself some flowers, or I get flowers from a friend or loved one, and I walk into the house and I see the flowers on the table, it gives me such a smile. So what I did, I had a small area at the front of my house. I went to Home Depot and I created an aesthetic little garden with orange flowers and yellow and green, and it's just so beautiful. So every time I drive into the yard and I see that area looking so colorful, it put a smile on my face. So what is it that put a smile on your face no matter what? Take a photo of it, put it on your phone. For social and spiritual tool, contact information for supportive colleagues, someone who you can talk, call, and vent and speak to. Inspirational quotes or personal mantra that you could have on your phone. A brief gratitude practice for shift transition, and even a small, meaningful object for staying grounded can help. So you want to customize your kit based on your unique needs and preference. Keep these resources easily accessible during your workday for moments when self-care is most needed. Advocating for a culture of self-care in healthcare. So when we talk about advocacy, now we're talking about the few slides, first set of slides, we're talking about taking care of yourself, which is good. But we want to talk about how can we advocate that the organization that you work with cultivate a culture of self-care on the unit. You do it individually, talk about unit advocacy, and then even on the system, especially if you're working for a large hospital. So first, individual, you want to model healthy boundaries by taking scheduled breaks, share an effective self-care strategy with your colleague to say, hey, you know what I did? What I do during, I get up early in the morning and go to the gym before I go to work. You want to normalize discussion of emotional challenges. You want to create informal support network within your units where nurses can voice opinion, talk about, what are some of the challenges they're having that actually impacts your work. So we're talking about that individually and unit area. You want to propose a dedicated quiet space for brief restoration. So a lot of hospitals may have a prayer room or have something like that. So if you don't, you can talk to your organization about that. Suggest rotating wellness champion on units who can go around and speak to nurses, or nurses could speak to them. They're considered wellness champion who talk about wellness and how they can care for themselves. Advocate for mental health days as a legitimate PTO, and also recommend self-care education in continuing education. So when your learning needs assessment come around and they're asking you what are some of the things that you like, you could include that. When you go to these leadership meetings, you could talk about including self-care, continuing education as a part of the system-wide organization benefits. All right, you want to create institutional changes, and it starts with small steps. Even one nurse practicing visible self-care can inspire the culture and shift within a unit, and from the unit to that satellite, and from that satellite to the system. All right. So first, model it yourself, and so that culture or that spirit of self-care can then be seen and identified as it being beneficial. And the truth is, when organizations are spending money, they want to know the bottom line. How is that a return on investment? And that's the truth. But remember, we discussed that a nurse who is stressed out, burned out, then they will have poor patient satisfaction, increased risk for much more error. So if these things are are implemented within the organization, then you have higher retention of nurses, lower medication or lower errors, and you have a greater patient satisfaction report. All right. Overcoming barriers to self-care. So, despite understanding the importance of self-care, many nurses face significant obstacle in implementing these things. So, in this section, we're going to examine common barriers and offer some practical strategies in how nurses can overcome them. So, time constraint. I know some of you guys may be saying, okay, what you're saying sounds good, but do we really have the time to stop and breathe? Long shifts, understaffed, competing personal responsibility, creating a perception that there is simple no time for self-care activities. That's one. Guilt and self-sacrifice. The professional culture often think that self-sacrifice is a good thing, making the nurse feel selfish for not prioritizing their own needs and well-being over others. So Compassion fatigue is another. The paradoxical that exhaustion that results from inadequate self-care can make it harder to initiate self-care practices. And then last but not least, institutional barriers, lack of supportive policy, inadequate breaks, and limited resources create a structural obstacle to self-care practices. So in a survey that was done over 1,000 nurses, 82% identified time constraint as their primary barrier to self-care, followed by guilt, 64%, and a lack of institutional support is 59. So these are some of the challenges that prevents nurses from taking care of themselves. Strategies to overcome barriers. Reframe self-care. When we talk about self-care and we think it is selfish to take care of yourself, if you reframe how you look at it, view self-care as a professional responsibility. You want to connect self-care to patient safety. Caring for yourself enhances your capacity to provide quality care. And when you're trying to implement anything on your unit or even in a system-wide organization, you can use this line as a reason too. If they're going to spend money to create a room where one can go and meditate or pray, caring for yourself enhances your capacity to provide quality care. And remember that self-care models healthy behavior for the patients. Sometimes you'll hear a patient who smokes, a healthcare provider is telling a patient to stop smoking, but when that patient is leaving, they see the healthcare provider outside smoking. You want to model that behavior. So practical approaches start with micro practices, 1 to 3 minutes. Integrate self-care into your existing routine. Use technology for reminders and quick guide practices. Create accountability partners with colleagues. Celebrate small successes to build momentum. Finding moments for self-care. Even the busiest nursing schedule contains small pockets of opportunity for self-care. So the key is identifying these moments and having simply practice ready to implement. The first 5 minutes after waking, you can, give gratitude, show gratitude, pray, take a deep breath. Commute time while you're on your way to work, instead of being on the phone with a friend or someone who's going to aggravate you, listen to a guided meditation. We talk about hand washing intervals through shift. You can use that time to really focus on, okay, I'm washing my hand, being present. What am I feeling? How much soap I'm using to be present during that time? Brief moments between patient interaction, scheduled breaks, even partial ones. The transition time between work and home, and the last few minutes before you sleep can be used. So how do you find the time? These are how you can find the time, even if you're busy. Self-compassion as a foundation. And that is so true. If you don't have compassion for yourself, you're not going to see the need for your self-care. So self-compassion is a foundation. And if you do not have self-compassion, you will not see the need for self-care. So mindfulness, awareness of suffering without over-identification or avoidance, noticing difficult emotions without being swept away by them. So practice. So when you feel overwhelmed, you want to acknowledge that this is a moment of suffering and observe sensation with curiosity. Common humanity. Recognize that struggle is a part of the shared human experience, not a personal fail or isolation. And so you want to remind yourself that other nurses feel this way too. I am not alone in this experience. Self-kindness. Offer the same care to yourself that you offer to a valued colleague or patient. Place a hand on your heart and speak kindly to yourself. We very rarely do so. Sometimes we are so hard on ourselves more than we are hard on others. So place your hand on your heart and speak kindly. This is hard. How can I care for myself in this moment? So Dr. Neff research showed that self-compassion reduces burnout more effectively than resilience training alone. Nurses who practice self-compassion show greater emotional resilience and maintain compassion for patients even during difficult circumstances. Your self-care plan in action. So an effective self-care plan includes space for daily intentions and priorities, schedule self-care activities, reflect on challenges and success, gratitude acknowledgement, physical and emotional and energy tracking, notes on what practices are most effective, adjustment as needed, and celebrate the progress. Doesn't matter how small it is. Many nurses find that a dedicated self-care journal help maintain focus and provide valuable insight over time. Digital alternative include specialized app or simple note-taking system can also be used. So to conclude, caring for yourself is caring for others. Self-care is not self-indulgence, it is self-preservation, and that is an act of political warfare. So in nursing, the boundaries between caring for ourselves and caring for others dissolve when we nurture our own well-being through intentional self-care practices. We enhance our capacity for authentic presence with patients. We model healthy behaviors for those in our care. We sustain our ability to serve with compassion and skills. We preserve the heart of nursing, our humanity and healing presence. So your well-being matter, not just for yourself, but for your patients, colleagues, loved ones, and the future of nursing practice. So begin your self-care journey today, knowing that each small step creates ripple of healing that extend far beyond yourself. Thank you so much, and hope you find this lecture very helpful as it relates to your self-care journey.